no more diabetes medications. Imagine that. A new program is helping local type 2 diabetics control their disease.
Channel 4 Action News anchor Michelle Wright talks to two patients on this brand new diet who are off their medication and their sugar readings are now normal. Michelle, this is amazing stuff.
Yeah, the readings are normal now. When I first heard that patients were having such great success, I had to learn more. So I headed to the Health Institute of Pittsburgh to hear more about a new program that seems to be working for some type 2 diabetes patients.
Their outlook was grim, both diagnosed with type 2 diabetes.
This year I was denied life insurance. They wouldn't insure me, and that was like the wake-up call.
They want me around. They want me to be around for a while.
And there was a chance at the rate you were going,
Yes.
you wouldn't be around.
No.
Edward is 58. He was diagnosed 10 years ago. He lost about 50 pounds, started eating right, but his diabetes just got worse.
My next step was insulin, and I said, I'm not doing it.
Normally that's the hamster wheel that they're on over their life. Their prescription lists are changed, altered, until they're maxed out, until finally the doctor says, hey, we have no other option but to put you on insulin.
A couple of months ago, Edward came to see Dr. Will Cole and try a new program at the Health Institute of Pittsburgh. It was his last chance.
I don't understand it, but it works.
His progress is amazing. The program starts with intensive blood work testing and analysis. Then an individual diet is prescribed based on how food impacts each patient's blood sugar. There are also supplements from Apex Energetics. Each patient gets different ones based on their individual need. Edward's diet includes eating 6 meals a day, which requires a lot of planning.
There's not one diabetic plan, there's not one diabetic diet, there's not one diabetic anything. Each patient has their own biochemical, physiological individuality.
Now, with diabetes, there are two numbers to know: daily glucose readings and something called the A1C level, which is a 3-month average of readings. Edward started 2 months ago with daily sugar readings in the 200s and an A1C level of 9.8, and that was with him taking medication. Today, he's not on any medication. His daily glucose readings are at 100, which is in the normal range, and A1C level is down to 6.1. 6.0 is diabetes-free. And keep in mind, that average includes 1 month before he ever started the program.
Because I already started having trouble with my legs, and that's gone. I'm not on any medication for sugar. That's gone.
58-year-old Karen was hoping for the same success. After being diagnosed 7 years ago, she found she was allergic to the diabetes medication. She didn't know what to do.
Inside, you just realize that you're a train wreck that's ready to happen. And so you live every day thinking, is today the day I'm going to have a stroke?
The intensive blood work here discovered she was gluten intolerant, something other doctors had not found. 2 months into the program, here are her numbers. Her daily glucose was 231, her A1C 10.5. Today, her daily reading is 100, and her A1C has dropped to 7.6. Again, 1 month included in that average is before she ever started this program. She's convinced her next reading will be amazing.
I finally found that missing piece that I was missing all those years of trying all the other programs.
Now, Dr. Cole says this program does not replace seeing your regular doctors. Instead, it's designed to work in conjunction with your doctor, who will actually look at your readings and then decide when you can get off of your medication. That's up to your regular doctor.